appearance around her mucous membranes or anything. As I look at her chest wall, it is unlabored. Her breasts are unlabored, and they look pretty smooth and rhythmic, so I'm not concerned about her having any extra muscles being used. Like right here, sometimes if people are breathing super deep, they'll have retractions of the I'm losing my train of thought. They'll have retractions of muscles right here, so it'll kind of suck in. They'll also have retraction of the diaphragm if they're having problems breathing, so this will kind of cave in also. So they'll have kind of like this movement going if they're having problems breathing. I do not see any of that going on with Alex. So color's good. Her rhythm of breathing is good. Her depth of breathing is good. The next thing I would want to do is actually check for the rate of breaths. The normal rate is 12 to 20. Okay, so I'm going to just time it. And you can count for 15 seconds and just multiply it by 4 for your 60 seconds instead of doing a whole 60 seconds. But I'm going to show you how I do it because I always check a pulse at the same time. You do not have to do it this way. You can check respiratory rate by looking at a clock and putting your hand on their shoulder. You do want to have some touch going on though, because some people breathe really shallow, and if you can't see it, you need to touch them to feel it, okay? So first inspect, then palpate if you need to. But what I'm gonna do is I'm just gonna inspect, and while I'm doing this, I'm gonna feel for a pulse here, and I'm checking the time, and I'm just gonna count her respirations for 15 seconds. And her respiratory rate is about 16. So, and now I'm going to continue to count, but this time I'm counting a pulse. And I'm counting for another 15 seconds starting now. And her pulse rate is about 70, okay? So we want to just kind of practice on that a little bit, but as far as respiratory rate, rhythm, and depth, it looks within her normal limits. There's no deficits I'm seeing at all. The next thing I'm going to do is I'm going to examine the thorax. So the thorax is the chest cavity, or the chest cave, okay? And I want to look at her from the side and the front and the rear. What I'm looking for is your anterior to posterior diameter. What means is that all of us have a front curvature. We should all have chest muscles, okay? So it's going to curve out a little bit. That's an expected finding. Spinal curvatures are not really normal, right? They're abnormal. It could mean that they have kyphosis or some type of scoliosis or something like that going on. So you may see a little bit of a curvature, but it shouldn't be significant. If it is, you need to document it. But what I want to see is a 2 on the front curve and a 1, a straight back, okay? That would be normal for someone without chronic lung disease. If, for instance, Alex had chronic lung disease, I might see a 2-to-2 ratio, okay? So with the front being curved and the back being curved, because of chest cavity will expand if they're having to use those accessory muscles for long periods of time. Also, the lung will expand, okay? On the lateral view here, I see that her chest wall, the thorax, is a 2-to-1 ratio. It's appropriate. Don't note that if there's any deficits there, okay? Now what I'm gonna have you do is stand up for me, okay? And I'm just gonna have you turn around, okay? The next thing, face the wall, okay? The next thing I'm doing is I'm going to look for thoracic expansion, okay? I'm gonna show you how to check to make sure it's equal on both sides. I'm not gonna require you to do the front, but in later testing, you may see that they're requiring the front. So I'm going to look for the base of where her rib cage is at, okay? And I'm placing my hands kind of around it here. And I just want you to take a deep breath for me. And I'm looking for my thumbs and hands to separate equally. Do it one more time. Okay. That's thoracic expansion, okay? Any pain or discomfort? Any problems breathing? Okay, I don't hear any abnormal sounds. All right, now I'm gonna do a palpation on her back, all right? And when I put my hands on your back, will you please say 99 for me?
99. 99.
Okay. So I was looking, you want me to do it again?
Yes, please.
Okay. Step it over one more time. Over here. All right, so now I am looking for tactile fremitus, okay? What I'm looking for is, does she have any consolidation, any masses, or any kind of fluid buildup in the lung space, okay? If you don't feel good vibration when the vocal cords move in the chest wall, then there could be some consolidation or lung damage or something going on, okay? So again, I'm gonna touch with this part of my hand, the palmar part of my hand, okay? And I'm gonna just start at the top and say 99.
99.
I'm coming in between her
99.
shoulder blades too.
99. 99. 99.
Good. And I don't feel any dullness at all. If you feel dullness or lack of that vibration, then we need to do some further testing, okay? Tactile fremitus, excursion. What am I missing?
Yep.
Okay, and percussion. So now we're gonna look for dullness or hyperresonance, okay, too. So again, between the shoulder blades, because this is where we're going to be able to hear this sound, and I'm just going to go laterally like this across your back, okay? Let me know if you have any pain or discomfort when I do this.
Okay.
And I'm just listening. Sounds good. I did not hear any dullness. Okay, did y'all hear any air?
Mm-mm.
Not like the bowels, right? Okay, good. All right. Now, while I have her standing here and we've done those three components, I'm gonna move on to listening to the lungs, okay? And I'm just gonna have my patient take a deep breath in, complete deep breath, and in and out, all right? And we're gonna listen through the whole movement. Okay, deep breath. Oh, these are horrible.
What one?
The stethoscope. Okay, you're gonna be expected to listen in 8 spots posteriorly. Then we're gonna do 2 on each side, okay? So medial, if you will lift your arm for me. I'm just gonna go posterior, anterior. So remember, there's that line in your t-shirt that happens. So posterior, anterior. Deep breath for me. Okay, and again. Good. And now I'm gonna have you turn towards our crowd. And one more time. Okay. And relax. And then I'm gonna do 8 on the front of the chest also. So the 8 on the front, you want to start above the clavicle, because remember guys, the lungs don't stop right here. They actually come up underneath here and kind of like this, okay? So the posterior and then anterior kind of wrapped on top of each other. So we want to listen up here and then start there. So we're just gonna have them, and the only time you're gonna hear irregular sounds on above the clavicle is if maybe there is a pneumothorax, something like that spontaneously might happen. So just a deep breath for me. Hers are really high. Your clavicles are high. And again. Okay. That was hard. Good. And remember, we want to don't go over the sternum when you're listening. And for all the ladies, you can just hover. Okay. Now, you will do 8 spots on the front too, or describe 8 spots on the front. I'm not gonna require you to put them on anybody's chest wall when you get to about right here, okay? But I will say that if you're working with someone that has large breast in the setting, have them lift it out of the way for you, okay? If they're unable to do that on their own, say for instance they're too weak, they're not cognitively with it or whatever, you can do it, but tell them what you're gonna do and use the back of your hand. We don't wanna cup anything. Remember that whole thing? Always use the back of the hand. Okay, let me see.
I think maybe just
that's it.
the pattern you check. You're missing. Isn't it supposed to be down like again that's up to right?
The book does show it, yeah, so what Dan is saying, turn around. I'm not going to mark you wrong for this, but the book shows you doing it from here to here and then down and then over, like kind of like this, okay? As long as I see you hit those lobes, I'm gonna be okay with that assessment, okay? The reason why we wanna just make sure that we're going through is for 2 reasons, right? Bilateral baseline. Remember the baseline always, okay? We need a baseline. What's it supposed to sound like versus what might be a problem on one side. Also, when we're listening, because remember we've got less lobes on one side than the other, making sure we hit those spaces, okay? A lot of people, if you'll turn towards the crowd again, thank you Alex, I'm giving your exercise. How many lobes are on this side? On the left?
There's 2, because they don't have a middle lobe, right?
Good, there's 2, there's a upper and lower lobe, right? Alright, how many are on this side? 3.
Because they have a middle.
Okay, now tell me where the middle lobe stops. Lift your arm up for me. Literally right here. It's like almost goes like this in a triangle. Okay? It's in between the anterior and posterior front and rear lobe. Like it sits up underneath here. So if we're not listening in this space and we have fluid in the lung and it's collected there, or air in the lung and it's collected there, you're gonna miss it every single time. So a lot of people forget to check this on this side, but it's really important. We show you to do it on both sides only because atelectasis is gonna start at the base of the lobe and then work its way up, okay? A lot of times this is where you're gonna hear your rhonchi and your crackles and all the funky stuff that's gonna happen, but it can move up, and when it gets to about right here, we have some issues that are about to start happening, right? Breathing issues, airway issues, everything else, so we have to be very cognizant of checking those areas. Anything else did I miss?
I don't know if it's on this one or if it was on the previous ones, but the clubbing, if you are expecting like barrel chesting,
Yeah,
they have
so
their
when
own
we're
preference,
looking
right?
at the color, everything, check for, cap refill. Cap refill's either this one or cardiac, cap refill, and then also check, for the clubbing, so. Okay, we did that one already, but I think it is on this one again, because it's with acute or chronic lung disease, okay? Chronic lung disease. I think that's it. That is respiratory.